we're going to bring in right now Marc Short, Chief of Staff to Vice President Mike Pence, who joins us this morning. Marc, thanks so much for being here. First of all, just top line, you're there at the White House. You're around the Vice President, the President, as these critical decisions are being made right before press conferences that everyone is watching. Take us behind the scenes of this process right now.
Well, good morning, Pete. Thanks for having me on. The task force that meets daily that the Vice President convenes will be meeting again this morning at 10 o'clock. Typically, we bring all sectors of the government together to bring to the fore the most important issues, and then the Vice President typically raises decisions that need to be made to the President. But I can't tell you, to your last segment, Pete, how encouraged we are to see all of America coming together in phenomenal ways. The spirit of America is really inspiring to all of us, and you're seeing the private sector partner and reach out to us and say, we want to retrofit our manufacturing facilities to provide more medical supplies if needed. We want to be there to help and provide supplies to those most in need. And we see that from pastors as well, and it's I think we're very encouraged that we're going to get over this hump. In the span has typically been 6 to 8 weeks where we've seen the outbreaks in Asia and where we've seen them elsewhere. And so we're encouraged with the way that the American people are cooperating with the 15-day guidance that the President provided to all Americans.
Marc, there's been a rumor about a nationwide quarantine. Can you address that?
Sure. It's not something that's been discussed inside our task force meetings. It's not on the agenda today. There are no plans for a nationwide quarantine.
And so when folks see the military mobilized, there's rumors of, will the National Guard be? Listen, I've been in the National Guard. There's no talk of this. There's been no directive of this.
No.
You will see it used in certain places, in certain states to supplement what's happening in healthcare places. But speak to that if you would.
So let's break that down for a second, Pete, because you're right. Typically, if National Guard's mobilized, it's a governor's direction. And what we're seeing right now is that 3 states have more than 50% of the cases. And in fact, more than 50% of new cases, unfortunately for y'all, are in New York City. But what we're seeing is that the contagion is really Washington, California, New York State. And the fatalities that we were most concerned about, obviously California and Washington and New York, we're now at basically at 250 plus. What we had said, the President, you heard, said when the initial numbers came out from the World Health Organization that the fatality rate was about 3.5%. Among those here in America, we're now down under 1.5%. And I know that doesn't give comfort to the families that have lost loved ones. But the reality is that as we provide more information, know more people, practice social distancing, you're continuing to see those numbers come down. And as we get more tests out on the market, naturally you're going to see the media exposed that there's more cases that test positive. But at the same time, you're seeing that the fatality rate continues to come down. And I think as we get more information, we provide more therapeutics that come on the market in the coming weeks, we're encouraged that trend's going to continue.
Absolutely. Marc, in your office, it hasn't gone without touching the Vice President's office. We heard reports now that a staffer in the Vice President's office has tested positive for coronavirus. Talk to us about that. Is the Vice President have any interaction with that individual?
I'm pleased to report that that individual is doing well. I've talked to him last night several times. He basically had a couple days of cold-like symptoms. He tested positive Thursday night. He was not in the office Tuesday, Wednesday, Thursday, Friday. He's had no direct contact with the Vice President or the President. We've had the normal contact tracing led by the White House Physician's Office to go through who he may have been in contact with previously. And some staff will take necessary precautions. But I'm pleased to report that he had very mild symptoms and is doing really well.
Good. Marc, this has not been an easy week by any stretch of the imagination. And as we go into next week, you hear just talk amongst your friends and your family that we don't know what's going to happen next week. And there's definitely concern. Testing going to be ramped up. NIH warning there could be 70,000 cases in the U.S. by next week. Dr. Fauci saying it's unclear when COVID-19 is going to reach its peak. Based upon the discussions that you have had with the Vice President and the meetings that he has had, and based upon the information that you're allowed to tell us, what do you anticipate for the next 7 days?
Well, Todd, I'm pleased to tell you that with the Vice President and the President's leadership, we pulled together a large number of private sector lab companies who have provided many more tests on the market. So the number of tests available has grown tenfold this week alone, and we'll probably see that again next week. So by deduction, as more and more people are tested, you're going to see those numbers go up. But encouraging, I think, for your audience is that we've only been asking people who have symptoms, fever, respiratory problems, others to get tested. So only those with symptoms are getting tested. And what we're seeing is less than 10% are actually infected. let's keep in mind this is also flu season, it's allergy season, and so the vast majority of people getting tested are testing negative. And even those who test positive, as we've said from the very beginning, the vast majority of those people do not face a risk of severe illness. The precautions that this administration has put in place is out of an abundance of caution to protect our most vulnerable, and the seniors who have underlying health conditions. And that's the backbone of the policy recommendations, to be extra cautious. But what we're seeing, and you will see more and more people test positive next week as more tests are available. But a lot of people, for instance, like the member on our staff, will have very mild symptoms or actually be asymptomatic altogether.
Mark, we only have a moment here, and we're rightfully focused on how we're reacting here as a country. But there have been reports recently that if China had acted sooner, if they'd been honest, if they'd had transparency from the beginning, a lot of this could have been prevented. President calling it the Chinese virus. What is the White House doing to sort of hold China responsible for unleashing a lot of this?
Well, Pete, I think there's no doubt about that. I do think it's true that if they'd been more forthcoming from the beginning, that it would have helped other nations to better prepare for this outbreak. Having said that, I think there'll be future actions down the road. Right now, China has been trying to provide equipment where there's deficits to other people. And so I think there'll be further discussions about responsibility they should have and should take in ways that they were trying to hide information. We also obviously are concerned about their disinformation campaigns and alleging that it came from other places. But I think there's probably going to be a day and a time for more appropriate actions with China.
You got it. Well, Marc Short, thank you. You're a busy man these days. We appreciate you taking a moment for us.
Thank you, sir.
Pete, thanks for having me on.